So the more I was in the hospital during clinical rotations, the more frequent the thought was of, do I really want to do this? Is this really how I see myself helping people? Hey guys, I'm Hillman, a medical graduate, and today I'm going to be sharing my student secrets with you guys. What motivated you to pursue medicine? For me, it was the desire to help people. I did not initially want to study medicine. I wanted to study artificial intelligence because making robots would make people's lives easier. And it's just, if you can tell a robot to cook food for you without having to do it, life is easy. So I wanted to make people's lives easier. When I came here, there were no bachelor programs for AI. So I looked for the next best thing I could use to help people. And medicine just was for the hand liegen. There was an option which I could easily grab onto. So I decided to go pursue medicine. What were the most rewarding aspects of your clinical rotations, and how did they shape your perspective on patient care? The first part of the question is definitely the patient contact. So the interactions I had with people and just seeing how people were in such a vulnerable position and you can mean something for them at such a vulnerable point in their lives. That was definitely the most rewarding time for me, because I noticed whenever I got the chance to have one-on-one interaction with patients and actually talk about them, and not necessarily what they're coming for, but them as people, I just left there with a boost of energy. Like, wow, this is a real person with real problems, and you can mean something for them in your own small way. Because, medical students don't get to do much, even though we tell them the whole world we're saving lives. We don't really get to do much. But the small moments like this, for me, really carry a lot of weight. And how did they shape your perspective on patient care? I think that just got me to really appreciate the person behind the pathology. It's not really just all about the pathology. Okay, those are important too. But a lot of the times I realize you can take away a lot of the problems, or at least the worries people have, by just talking to them, giving them the space to actually express themselves and letting them tell you what they are really struggling with. Because a lot of the times it's not what they come with. It's deeper than that. And if you can get to that point, you can solve half the problems. So that was a perspective shift which I had just by interacting with patients on a deeper level. Can you describe a particularly challenging moment during your medical school journey? Believe it or not, it was the last 2 months. Oh, everything seemed like it was falling apart. I have never questioned doing medicine as much in my whole 6 years of doing medicine as I did in the last 2 months. It was just all of a sudden, everything with my supervisor was not going okay. Everything with the hospital was not feeling okay. Had so many dilemmas and stuff. I was like, why am I doing this? Do I want to do this? Can I finish this? I was 2 months away, so I knew I was not going to stop. But I questioned it so many times just because so many things seemed like they were clashing. In my head, the devil was just intensifying his battles. It's just like it was not physical anymore. I really felt like it was a spiritual thing. So the last 2 months for me, I cannot really say why exactly, like what exactly was causing it. I know some parts of it were like the interactions I had with colleagues at work, or the things I was having, or problems I was having with studying and stuff like that. I cannot really say everything that contributed to it, but it just felt very heavy the last 2 months. So those were by far the most challenging moments for me.
And what did you do to overcome them?
Talked a lot. I definitely talked with friends a lot about it, and I prayed a lot about it. Those were the two things that really worked to just give me the peace. Because there was not that much I could control physically, because I wasn't really, that's why I felt like it was spiritual. I wasn't really aware of all the things that were actually contributing to making it difficult. So I was like, I cannot physically identify all the things that are contributing to this. So the best I can do is just at least talk about it so it does not pile up in my head, and pray about it so I just have peace to deal with whatever I have to. I just keep going to the hospital. So those are the two things I did about it. Was there ever a time you questioned your decision to study medicine? Yes. In the last 2 months, I questioned a lot. But before that, I don't think there was really ever a time when I questioned. That's a lie. I did question it more during the masters. So the more I was in the hospital during clinical rotations, the more frequent the thought was of, do I really want to do this? Is this really how I see myself helping people? Because once in a while you have this fulfilling patient interactions, but a lot of the other times it's just come in, come out. Come in, pathology, okay, you are the gallbladder, go out. You're the broken knee, go out. So then there was not really that, that interaction I described earlier, that was not there 80% of the time. The one time it was there, it felt really great, but majority of the time it was not there. And I was like, is this the way I really want to use my skill set and the passions and stuff I have? And the answer kept coming out as no. And because of that, I kept questioning more and more, is this really it? And I spoke to friends, and all my friends who I spoke to about this in depth were always worried about, but you're not going to stop, right? I'm like, no, I'm not going to stop, because I've already come more than halfway. But it was a question that kept coming now and again, just in the last 2 months, more frequently. If you could change one thing about your med school experience, what would it be and why? In the beginning of med school, because I did medical school in Dutch after speaking Dutch for a few months, right? In the beginning, I was struggling so hard to prove to people that I was native Dutch. Very unrealistic expectation, right? But the thing is, you have to understand I'm surrounded by Dutch classmates. Everyone is native. So then everyone, because of the nature of the study program, which is problem-based learning, you constantly have to talk and contribute and participate. Otherwise, it's like your grade might be affected by that. So I constantly had to also talk and contribute. Speaking Dutch for a few months, I could not make full sentences. And you can imagine, because I came from an environment where I was very articulate and I'm used to expressing difficult concepts in very simplified ways. But my mastery of Dutch was not that wow. And I did not want to switch to English, because I think my classmates will understand if I did. But I did not want to do that, because it's just my self-esteem. The whole class has to be dragged to English because of me. I did not want that. So I kept trying to place the expectation on myself to perform the same way I performed in English in Dutch. And that just did not work in year one. I just put too much pressure on myself. I had very unrealistic expectations. And I feel like that took away from me the experience of just being a student in year one. Because there was so much I was trying to perform and live up to, where I did not enjoy my student time because I was trying so hard to be accepted, to show people I was better, and to prove that I was something which I was not. I was not native, I'm not native, and I'm never going to be native. So just trying to prove that, it just makes no sense now looking back at it. But back then it was something which for me I felt like was very important, like I had to. And I feel like if I was to go back and change one thing, I'll just tell myself, do the best you can and just let the rest to God, let the rest to the universe. It will figure it out. And not put necessarily that amount of pressure on myself, because I feel like it took away from just enjoying the start of uni life. Were there any study habits that didn't work for you, and how did you adjust your approach? This is an interesting question, because in the moment I did not know this. It's only retrospectively where I'm like, oh, I could have done that better. So you know how there's a lot of summaries for students, right? There's a lot of like, you have this block, this period, and there's a summary available for you. So as opposed to you going to the library and actually picking the textbooks and reading in depth and understanding the concept very detailed, you would just, towards the exam, pick the summary and study the summary, because that's all you need to know for the exam. I did that a lot because, of course, year two, trying to adjust party life and everything, catching up, I did not have time to actually go into the library, or I chose to do other things than going to the library. So then I would, towards the exam, pick up the summaries and study the summaries for the exam and pass. That's all you need to do, just pass, right? You're not aiming to be, no, just pass, because life, there's more to life than just the grades. And during the masters, I noticed that it was catching up on me. The fact that I did not really go deep into understanding the concept, that really showed itself as you don't understand fully what you're talking about. You have an idea because you read the summaries, so you could recognize stuff, but you don't understand the ins and outs of why the concepts work the way they work. And I feel like in the moment, I passed the exam, so it's like, okay, you're doing what you're supposed to do. But retrospectively, if I went back and I was to change something, I would make sure that I made more time to actually go into the library, sit down with those textbooks, and understand the actual concepts. Because when you understand that, it just sticks better. If it can make sense to you, like if you actually understand the ins and outs of it, the knowledge lasts longer as well. And I feel like from the summaries, for the moment it was nice, it was great, but in the long term, you notice that the knowledge is not really as like solidly rooted as it was supposed to be. So I feel like if I was to go back and change the study habit, I would just make more time to go into the library, sit down with the books as long as it takes, and just make sure that I understand the foundational fundamental concepts. Can you share any tips on how to approach clinical case questions during exams? One is, don't think too much about the questions. But at the same time, sometimes there's like a hidden clue in the question, like the patient's demographic. Is the patient Egyptian, as a result of which they might be more prone to certain liver inflammations, stuff like that, right? those things could be hidden in there where if you don't think deeply about the question, the different parts of the question, you might miss it. So I feel like the answer is twofold. On the one hand, try sometimes to not think too much about the question. And on the other hand, it's like try to identify if there are some hidden clues as to things which could be fundamental in helping you answer the question. But like it really depends on the question that you're being asked and what scenario is being placed in front of you. Because a lot of the times, the ones where you don't need to think too much about it are just knowledge questions that might be tied to a clinical question. But there's sometimes clinical questions that require you to have a clinical approach. And then those times, they really want to understand how well you're versed with the differences and the nuances that come in the daily clinic. And then for those ones, you need to think about the small details. But if it's a clinical looking question that asks a fundamental knowledge question, try to not think too much about it, because sometimes they're trying to trick you and you can fall into that pit. What is the most unexpected thing you've learned after graduating med school that med school didn't prepare you for? I don't know if this was the question is asking, but just the fundamentals of dealing with finances as a medical graduate. Nothing to do with med school related, but that was something which I was not prepared for. But like, there's no course in med school that teaches you the ins and outs of navigating life as an adult, as a medical doctor, financially, right? That's something which I just struggle a lot with. But another thing which I can mention, which is also medical related, is the prevention side of things. Just the things which you can do as a doctor to help your patients, not necessarily medically related, like lifestyle changes, food and nutrition, a lot more of prevention things as opposed to trying to cure the things when they already have pathologies. So I feel like we doctors, a lot of the times, we get courses about them, don't get me wrong, now and then. We get a sprinkle of nutrition here, a sprinkle of physical health is important, or physical activity is important, a sprinkle of these things here and there, but we're not really taught to navigate the prevention side adequately, in my opinion, where if you leave, you're so tied to, you have a problem, okay, I have a pill for you. You have a problem, okay, I have a medication, I have a therapy, I have a treatment option for you. But we cannot really advise people on like, okay, these are the things you can eat to maybe increase the chances of reacting well to the lifestyle changes or the medication that you're going to be using. Whereas like we very often have a one-sided treatment, where there is more awareness coming into place about prevention in the practice. But I feel like as a medical student, we don't really get much about like how important prevention is. And that's something that post-graduating, I'm realizing more. Just prevention is key. And we need to focus more on that, because that's how we can sustainably make the medical system the best. Because the way it's going now, it's not sustainable. If we don't focus more on prevention, we're going to get to a point where it's not doable anymore. If you could go back to the start of your med school journey, what advice would you give your younger self? The 6 years are going to go by fast. So make the most of the time, as in enjoy, live out, be a student, allow yourself be a student. Don't try to fast forward time and get 6 years ahead of yourself. No, go with the flow, be a student. At the same time, be very intentional with who you want to be and what you need to do or what you need to get to that point. So don't enjoy, forget that there is a future to come, but have a good balance between enjoying yourself, making the most of your student time, and allowing yourself just experience what it's like to be a student. At the same time, if you want to be a cardiologist, nephrologist, go do the things you need to do. Go network, go do research, go do those things. Find a good balance which does not compromise you in either being and enjoying yourself as a student, but also does not compromise you in the future as the professional you want to be. I feel like just being intentional with finding that balance is something I would have wanted someone to tell me to be more intentional about when I started med school. Thank you for being with me today, guys. These questions were actually quite interesting. Some of them caught me off guard, but hope you enjoyed it, hope you learned something from it. If you would like to hear from other students as well, do not forget to subscribe.